I'm Dr. Linda Chang, and I'm a gynecologist with Orange County Women's Medical Group, a home-partnered OBGYN group. My part of the talk tonight, I'll say the analogy is like a flight attendant announcement. It's not all that fun or interesting. I feel like we've all heard it before, and let's get on with the flight already. But were we to encounter turbulence, we'd be awfully glad that we had our tray table stowed and our seatbelts fastened, right? So with that in mind, and for a safe and happy relational flight journey, I'd like to talk about the issues of, or the topics of, contraception and sexually transmitted infections. So first I'd like to talk about contraception. And abstinence is a very effective form of contraception. And for some people, abstinence is is the best option for them. Certainly women have healthy and satisfying relationships in that scenario. Whether it is for personal values or medical conditions or even logistics, this can certainly be a workable option. And as we'll talk about more in the second half, clear communication and setting boundaries is especially important for this option. The second category of contraception is barrier methods, which are condoms and diaphragms. Now, these methods are only as effective as they are used correctly and consistently. As I'm sure you know, in a perfect world, they would be perfectly effective, but in real life, they are less than 80% effective. But of course, the big benefit of barrier methods is that they do help prevent sexually transmitted infections, although not every type, and I'll get into that some more at the second part. There are a number of hormonal options. The most popular are birth control pills. I'm sure you're familiar with many of them. There are varying doses and they have varying schedules. Some pills will give you a spaced apart period, some not at all. And they all work by overriding your ovaries, kind of keeping them quiet so that there's no ovulation. There are two variants of the pill. One, they're not pills. One is a vaginal ring that releases the same type of hormones, and that's dosed monthly, and a birth control patch that's applied weekly. They're all in the same category. Again, they all work by suppressing ovulation, so the side effect profile or the benefits profile are very similar. Birth control pills and these methods are greater than 99% effective if used correctly, but again, in real life, perfect use is hard to come by. People do miss pills. And then lastly, there's the category of long-acting reversible contraceptives. There's a shot called Depo-Provera, which is a once every 3-month injection of progesterone. There's also an arm implant. It's called Nexplanon. It goes under the skin of your arm and it lasts for 3 years. These are both hormonal methods. And then there's also the category of IUDs. That stands for intrauterine device. They're about an inch-long T-shaped device that's placed into the uterine cavity in an office procedure. Some are non-hormonal, some are hormonal, and they can last for between 3, 5, and 10 years, depending on the ones that you choose. So the great beauty of the long-acting reversible contraceptives are that they're not dependent on you dosing, maintaining. Once it's in, then you're covered for the duration of that device. The other nice thing is that it can be reversed at any time. You do not have to use a 10-year IUD for the full 10 years. You can take out at any time. And because real life use actually mirrors perfect use, because you don't have to really maintain or do anything, effectiveness is very high, well over 99%. So the second part I'd like to talk about are the sexually transmitted infections. Our topic today is healthy relationships, and so certainly infection prevention is a part of keeping a relationship healthy. The most serious infections are the ones that are the least common. So infections like HIV, hepatitis B, hepatitis C, and syphilis. These infections are generally tested for through blood, and they do have an asymptomatic time period, so people may not have any signs or symptoms, but they can be screened for through blood work. There is a very effective vaccine against hepatitis B that is part of the kind of routine or required vaccines in childhood, so most people are immune. And then secondly, the most common sexually transmitted infections are bacterial. These include chlamydia and gonorrhea. These can be tested for through vaginal swabs, through urethral swabs, or through a urine specimen. These are usually readily treated with an antibiotic course. One important thing to remember about bacterial sexual infections are that you can get reinfected. So you can have had an infection, been fully treated and cleared, but if you have an exposure again, you can have another infection. These infections are effectively prevented from transmission with condoms, with barrier methods. We care about those even when they're not causing significant symptoms, and often they do not, because they are a leading cause of female infertility. They affect fallopian tubes. Then there are two viral sexually transmitted infections, which are kind of tricky, and they also have very similar names. The first is human papillomavirus, HPV. It's really kind of a ubiquitous virus. In the US, at any time, 80 million people are going to have an HPV infection. Most of these infections do clear, usually without the patient ever even having been diagnosed if you're not screened at that time, via your own immune system. There's no medication that makes it go away, nothing in particular that one would do to make it clear away any faster than it's going to. And transmission can occur even without penetration intercourse. So condom use, although helpful, is not fully protective. So genital to genital skin contact or genital to oral contact can transmit HPV, human papillomavirus. We care about HPV, which is almost always asymptomatic, causing no problems or symptoms, because it is the necessary, although not sufficient, cause for cervical precancer and cancer. What I mean by that is it's the first step towards cervical cancer, and you need HPV for that progression to occur. But in the vast majority of circumstances, it does not progress. The infection clears on its own, and people remain healthy. But it is a very common virus. It can cause this serious illness. So we do have a very effective vaccine. Probably you guys are familiar with Gardasil, which protects against currently the 9 most common types of HPV. Unfortunately, there are many subtypes of HPV. And recently, this vaccine has had an extended age indication. It was previously approved for up to age 26, and now it's to age 45. And there is no age limit as to when you might get an HPV infection, right? So if you're exposed, definitely can get infected. And so I think it's a great idea that that age indication was expanded. And again, the vast majority of people will clear HPV on their own. And to remember that it is such a common infection that does not, in the vast majority of instances, cause any health sequelae is an important thing, hopefully reassuring. The second virus is HSV. Sorry, that sounds so much like HPV. That stands for herpes simplex virus. This is also a very common virus. Estimates are that between 10 to 15% of adults get infected with HSV, herpes. And very often at the time of transmission, there are no symptoms. And for some people, you only know that they have it if they've been tested for it. They may never have an outbreak, genital sores, which are the most common manifestation. They may have an infection and for decades or their entire life may never have outbreaks. There are other people who may have painful monthly outbreaks. So the sequelae are very variable, they're very individual. There is no medication that gets rid of herpes. And unfortunately, the herpes virus likes to hide in nerve cells, and they can do so very quietly and without triggering one's immune system. There are medications that help to suppress outbreaks for people who have frequent outbreaks, and also help to minimize symptomatic outbreaks for people who have that. So like HPV, herpes can be transmitted without penetration. So if you have genital to genital skin contact or genital oral, that can be transmitted. There is not as significant a health consequence from herpes as with HPV, so no cancer risk or other systemic illness. But there are a couple scenarios where it can be more significant. So in particular, pregnant women, if they were to have a herpes outbreak at the time of delivery, that can be transmitted to their newborn and cause a more severe infection. So often if that's something that's a concern, then women would be counseled to undergo a cesarean delivery rather than a vaginal. All right, so I also want to talk a little bit about physical issues that can interfere with healthy or satisfying sexual activity, kind of pain syndromes. There are hymenal and vaginal malformations that are not very common, but certainly a possibility. Septums or hymenal tags. Vaginal atrophy is actually very common in perimenopausal, menopausal women, and also women who are breastfeeding. These are all low estrogen times, and that can cause thinning of the vagina and painful intercourse. There's a vulvar skin condition, vulvar dystrophy, that can cause painful intercourse. There are pain syndromes like vulvodynia, vaginismus, which is an involuntary tightening of the pelvic floor muscles, pelvic floor dysfunction, interstitial cystitis. There are also pelvic anatomic abnormalities like fibroids or ovarian cysts or endometriosis. So my general kind of summation of that would be, if intercourse is rarely uncomfortable and mildly uncomfortable, it can be observed, and so you can sort of chalk it up, at least the first time, to individual fluctuations. But if intercourse is repeatedly uncomfortable or severely uncomfortable, any of the conditions I mentioned might be the cause. So I would certainly encourage women to consult with their gynecologist, get evaluation, because there are effective treatments for a lot of what I've just reviewed. So I hope my portion of the talk inspired a reasonable amount of precaution and safe behaviors without being a total downer, because that was not my intention. So I'll hand over the mic to Dr. Buehler for the second part.
Hi. Can everybody hear me? Yes, okay. So I'm Dr. Stephanie Buehler. I practice right here 2 days a week, and 1 day a week I'm in Newport Beach seeing clients. Really, 100% of my practice is sex therapy. So I'm a psychologist, a licensed psychologist. I went and got specialized training so that I could help people with all kinds of sexual issues. And of course, if you're having sexual issues, you might be having relationship issues. So people sometimes call me and they say, I have something like bothering me sexually, but I think there's a relationship issue too. Do you treat both of those? I'm like, yes. How would I treat one without the other? I don't know. So I do treat the sexual and relationship issues. And of course, because I treat relationship issues, I get a lot of people coming into my office who are dating. I haven't dated in years, but I've worked with countless people who are dating. And certainly observing the dating scene now and seeing what's going on, if I had to be out there dating, I would approach it with some trepidation, I must admit, because I think things happen very quickly. I think that it can be overwhelming. It can be tiring, is what I hear from a lot of people. Discouraging, but it's supposed to be fun, right? I mean, that's the idea, is that you're single and free, you have your freedom, anything could happen, you can meet anyone at any time. That should be exciting, right? How many of you are really excited about dating? Okay, like one little person there. Okay, so let's talk about maybe some ways we can make it a better experience. One that's more satisfying for you. So I'll talk about a few different things. I want to talk to you about fixing your picker. Lots of people have problems with their picker, and coping with rejection, figuring out how to get out there and meet people, dealing with hard topics when you're dating, and consent and safe sex, very important. So my overarching message to you is to slow down and be reflective. Don't be so reactive. Think about, be mindful about your dating activity, right? So, one of the first things you want to do is think about your template. Like, who is it that you're wanting to meet? And
how is it that you find that person? Not that you're going to meet the perfect person. Nobody ever, if somebody comes in, a couple comes into my office and they go, we have an almost perfect relationship. I'm like, uh-oh, something's wrong. You're not fighting enough. So you never meet, it's not about perfection. It's about getting a template in your mind of who you want to meet, who would be a good match for you if you are looking, in fact, for a long-term partner. If you're not, then who cares? You can say, oh, I want somebody, very tall, or I don't care about height, I want somebody with an athletic build, I want somebody who likes to cycle or hike. That's fine. But if you're really looking for someone to develop a relationship with, you want to have a template in your head. And the way that you can do that, this actually came from a client who got out of a very unsatisfying marriage. And he said, you know what I'm going to do? And I said, what? What are you going to do? I'm going to make a list. I'm going to make it 3 parts. One part is going to be things I must have in a person that I'm going to date in any kind of long-term way. One is going to be things I can't stand, and one is going to be things that, I can tolerate, right? So must have, dependable, loyal, average intelligence or above, steady job, right? Those kinds of things, a sense of fun, those are good things. Things I can't stand, everybody's different. Smoking, out. Marijuana, out. Not paying bills, out, right? Sloppy house, out, right? Things that are okay. Has a weird laugh, right? Has a boring job. I don't care what kind of job the person has, doesn't, it would be nice if they travel, but if they don't like travel, that's okay. If they would be adventurous with food, that would be good, but it's not a deal breaker. So you just have to have an idea in your head. And then as you're dating, I want you to think of yourself as a collector of data. Right? You are not out there, you're out there to meet somebody, check them out, ask them some questions. You could think about your template, ask questions based on what you've written down, right? And then you can, when you go home, take your list out and look at it and go, well, who did I meet? And maybe you won't get that on the first date, the first time that you meet them, but maybe after a couple of times, I would certainly reflect. Like, who is this person that I'm going out with? Because, you can have all the chemistry in the world. Chemistry is, it has its place. It's important, but it's not everything. Not by any stretch of the imagination. You can have amazing chemistry and have a really awful relationship, right? You can also have a really great relationship with no chemistry. You have to kind of find a balance there. But, the chemistry doesn't tell the whole story. One thing I will say, we have a population of people here from India, either from India or second generation, Indian American. And, a lot of them are in arranged marriages. And when I first had, people in arranged marriages coming into my office, I thought, nobody talked to me about this in graduate school. I don't know. We did a lot of work on couples therapy. So I did my reading on arranged marriages, and they are very satisfied for the most part. Right? So the relationship is not based on chemistry, it's based on mutual respect. Right? Well, that's a different culture. I'm not telling you to go ask your parents to find you a partner. I don't think I would have liked it if my mother had found someone for me. Thank you very much. I'm really happy that she did not. But I'm just telling you that to give you something to think about. Like, how are you going about
finding somebody to date. And then the other thing too is be choosy, be willing to take a pass. If somebody doesn't fit your template, be willing to say, very nice to have met you, but I don't think this is something that's going to go anywhere. And so, thank you for your time. Bye. Right? Okay, and we'll talk more about rejection in a little bit. I think too, have a good idea about what it is that you're looking for. Are you just looking for companionship? Are you looking for somebody long term? Are you looking for marriage? Are you looking for someone to have children with? Know what your aims are and talk to the people you are dating about that. I think, for the people who want marriage, want children, maybe both, maybe just marriage, those people are very upfront often about the fact that that's what they're looking for. And if the person that they date is not interested, they take a pass. They don't put yourself through, hoping and waiting and begging and praying that this person who really showed no interest in a long-term committed relationship, if that's not where they're at, move on. Find somebody else. There are plenty of fish. I was talking with my husband at breakfast this morning. We said, there are plenty of fish. He said, yeah, unfortunately, a lot of them are blowfish. I said, yes, but, you have to be willing to, see what you catch on your line, take a look at it, see if it's worthy, and if it's not, toss it back in, right? Okay, so that, okay, so I think something that they just filmed me talking about rejection. I think something else that's really important is while you are on this journey of dating, you maybe got out of one relationship, maybe you got divorced, maybe you went through a breakup, maybe you were focused on your career for a year or two, and now you're trying to get back into being social again, that really you should focus on yourself while you're in this process of dating. Finding things that you like, doing things that you enjoy, increasing your self-care, hanging out with your fun friends, taking a class, going to meetups, doing fun things. Don't sit in your house isolating. Do things that make you feel good about yourself. People pick up somehow. It's not a conscious thing. Again, it's like a template. People pick up, are you a confident person with good boundaries, who knows yourself and knows what you want? That's going to be a whole different experience, isn't it? When somebody meets you and you're in that kind of space, I feel good about myself, I know who I am, I know my values, pretty much know what I want. That's going to be very different than being kind of wishy-washy or desperate. I need somebody in my life to define me, give me a sense of purpose, give me meaning. Find that for yourself. Eventually, when you find somebody else, you can develop a joint meaning, joint purpose. But while you're on your own, take care of you. Right? Yeah, very important. With rejection, how many here have never rejected anybody? Anybody here never ever? Never said, I'll take a pass? So everybody here has sometime in their dating life said, no, maybe they're nice, or whatever, they're nice, but they're not your type, or whatever, or they're not your type at all, and it's just not what you're looking for, and you said pass, right? Well, people get to say that about you. You know, I'm sorry, here's the big, like, headline is that not everybody is going to love you. I'm sorry to break that news to you. All right. And not everybody loves me, and that's okay. And, you know, you just accept that it's part of the process. And again, if you feel good about yourself, then if somebody isn't interested in you, you can really say, their loss. Right? Their loss. Moving on. Next. Somebody, I had a client who once said to me, she had this old auntie who used to say, men are like buses, another one comes along every 5 minutes, right? So there's always more, plenty of fish. Think about, treat it as rejection as a normal occurrence. Don't treat it like it's a big catastrophe. Don't like, oh my God, oh, another rejection, oh, that's terrible. You just go, oh well, I guess it wasn't a good fit. You know, I have to tell you, I mean, I'm a psychologist, sometimes I'm not a good fit. Right? People call me, they come into my office, every once in a while I get a call, I don't think it was a good fit. Oh, okay, here's some referrals, bye. Oh, I don't worry about it. If I did, it'd crush me. I just say, well, it's just, that's what psychologists say. Oh, just not a good fit. And move on. How to meet people. Of course, everybody is online. How many of you are doing online dating? Not everybody. Okay. About a third. So, you know, some people really enjoy online dating. How many of you enjoy online dating? The people that nobody enjoys it. Yeah, it sounds hard. It sounds like a lot of work. That's what people say. It's time consuming, and it's a lot of work, and you know, sometimes things lead nowhere. And anyway, I think, and of course, if you're an introvert, online dating and then going out and meeting somebody that you don't know, I think that's tough, right? What works is going to the same place over and over again to create familiarity. That's a good thing to do. That's why meeting somebody, if you are at all inclined to go to church, and you know, maybe you are, maybe you aren't, but if you are, that can be a good place because you're seeing the same people over and over again, and you know, you start to get to know people in a different context, right? So that's good. It's a nice slow way of meeting. But if that's not your cup of tea, get out there and do meetups. That's how so many of my clients meet people. You know, they follow their bliss, whatever it is, hiking, Sierra Club, cycling, you know, bird watching. We were just talking about bird watching, cars. If you like cars at all, woohoo, that's good. There's a good place to hang out, car shows and that kind of thing. Go with a friend and go hang out at a car show. Taking classes, you know, here in Irvine, we have so many classes that you can go and take. Go to cooking classes, go to photography classes, art classes, whatever turns you on. If you have social anxiety, which I know many people do, it's actually kind of an epidemic in our culture. Why? Because people are kind of staying in, they're watching Netflix and looking at their computer instead of getting out and talking to real people. So if you have social anxiety, just focus on the other person. That's old advice from Dear Abby. Anybody remember Dear Abby? Right? She would say that all the time. Don't think about yourself. Focus your conversation, draw the other person out, get to know them, and then you become less self-conscious. If you really have social anxiety, you want to hear about my classic exercises. And I send my clients to Trader Joe's because the checkers are so friendly. And I say, just go and start conversations with the checkers at Trader Joe's and just get used to starting up a conversation and engaging somebody. And that's a way to overcome some social anxiety. Start slowly with your dating activities. Oh my God, I hear people like, they've been dating 2 weeks and they're making a plan to go on a trip to Hawaii. And I'm like, I wouldn't go with a stray dog that I knew for 2 weeks on a trip to Hawaii. Go slowly. This is not, dating isn't a race. You don't have to be, again, if you feel good about yourself, you're not going to feel like that sense of loneliness that's going to compel you to date anybody who's willing to date me, that's what I want to date. No, you want to be thoughtful about who you're dating. So start coffee dates. I recently had somebody in my office. We don't have any men here tonight. Do we? One? No? Okay, interesting. Men, if you think women have it hard, men do too. And he was taking all these women out to dinner, and it was getting expensive. And I said, duh, that's going to get expensive. No, you start with coffee, right? You start with coffee, you go out for coffee, maybe then you go get some lunch together, maybe during the workday, and then you maybe you go on a hike, go for a walk on the beach, something along those lines, then go out to dinner, right? So, just take it slow, right? Even if I go to a conference, I don't go to dinner with the first person I meet at the conference. I kind of talk to a few different people, maybe hang out with them in the morning, have some coffee, figure out if I want to spend an evening with them before I do that. So I'm not dating, but I'm spending my time resources wisely. Be smart and be safe. Terrible things do happen, and certainly I wouldn't want anything terrible to happen to anyone, male, female. Don't be so quick to go to somebody's house. Somebody says, "Hey, come over, hang out." Wrong. Don't invite them over. Don't meet at your house. Homes are, you can be isolated in your house, right? So that's not a good idea unless you know somebody. Always keep your drink, you probably know this, but always keep your drink with you when you are out. Hand over your drink. Take it with you into the bathroom, right? Put it on the counter. Yeah, don't leave your drinks unattended. Make sure your phone is charged before you go out. Always look to see that your phone is charged. Always let someone know where you're going. Consider, a lot of my clients have like a check-in buddy, somebody that's going to send a text or call them. When you see that person's name come up, that, I'm going to answer this. And I'm going to say, oh yeah, I'm out with somebody new that I met, and it's going great. Or, you know what, oh, I see, yeah, there's something, oh yeah, I better get going. Then you have your excuse, like, peace out, right? So that's a very good thing to do. And then finally, like thinking about consent, right? We're talking about boundaries, right? And, sometimes people find themselves in situations, maybe they've had too much to drink, maybe they're trying to feel good about themselves in a way that may not be especially healthy. But I would tell you to take care of yourself and don't engage in anything that you do not want to do. don't let anyone ever coerce you into anything. Maintain your boundaries and your safety and your sense of self. And, if you enjoy, some people, these days, people enjoy sexual experimentation, that's fine, but know who it is that you're with. And know the person well enough that you can communicate what's okay, what isn't okay for you. Don't get yourself into, I've heard stories, knock on wood, nobody's ever really been hurt, but clients who've gotten themselves into really peculiar situations. I don't want anyone to get into a peculiar situation, right? So it's okay to say no, and it's okay to say, I think I'm done. I think I'm done for the evening. Peace out. I'm going to bounce. Bye. Okay. Last thing I'm going to talk about, dealing with hard topics. So, I work with a lot of people who have cancer, whether they, men with prostate cancer, women who've had breast cancer, people who have genital herpes, and they're worried about dating. Maybe somebody has gone through a really difficult divorce. Maybe have depression, something along those lines that you're managing. And, you need to be open about that, right? So how do you do that? A lot of people come into my office with a pad and a pen because we're going to work out how to say something, right? And so I will tell you some of the conversations, some of the ways that that people in my office have figured out how to have hard conversations. So we call it like an elevator speech. You hear of that? Like a career, how do you talk about your career in a short elevator ride? Well, that's what you want to do. You want to overwhelm somebody that you're dating. I had a friend, a colleague, who had sickle cell anemia. It was very serious, right? Sickle cell anemia. She was single. And I asked her, I said, Felicia, when you're dating, how do you tell people that you are dating that you have sickle cell? And she said, oh, I tell them on the third date. That's my rule, third date. And I say, there's something about me that you need to know. I have sickle cell anemia. They don't know what that is. I talk to them about it. And you know what? Sometimes they go, no, thank you. That is a little too heavy for me. And she goes, that's fine, because if you can't handle what's going on with me, we're not a good fit. We're not a match. So, she just lets them go. And, and then other men that she's dated are, they're like, whatever, whatever it is, I like you, I want to still get to know you, let's keep dating. Great. So here, for example, is a way to talk about something. So you could say, for example, there is something about me that you need to know if we're going to continue dating. It's that I have herpes, and I take a medication to manage it and take care of it, and I usually know when it's active, but that's something you really need to know about me. If you want to talk about it, you have any questions about that, I'm fine. I'm open to talking about it. Right. I've had people decide isolate themselves because they have genital herpes. Well, you heard how many people have it. It's pretty much an epidemic. And so chances are the person that you're saying that to may have it too. It's very possible. So, but you have to let them know. Oh my gosh, I've had people who get married and they find out after they're married that the person they married has herpes, and they're like, what? And they'll still love that person. The relationship will go on, but there's a little bit of trust broken there. So you want to be open about things like that. head off problems of the past. Here's another way. There's something important to me that you need to know. This is a hard one, a very hard one. I grew up in a household where there was abuse, and one of my parents was an alcoholic. And for that reason, I'm very careful about how much alcohol I use. And it's important to me that my partner be careful about his alcohol use as well. Ooh. Right? Like, what are you going to accept? Remember I talked about your template. If you grew up in a household where, lots of people come into my office and they say, I didn't really have great role models for what a healthy relationship is supposed to look like. But you want to change that. You want to be the person that breaks the cycle and has the healthy relationship. So maybe you need to say something like that. Here's another one. I feel like we may be heading toward becoming physically intimate. So there's something I want to tell you. I've had a problem in the past with sex being painful. And I've done several things to manage the problem. I've gone to pelvic floor physical therapy with Kathleen back there, and I saw Dr. Chung, and I've done several things, but it does mean that when the time comes, I'm going to need you to be patient. So things have to happen slowly for me. If you want to talk about that, I'm open to it. You can do it. You can have a hard conversation, and I'm telling you, any guy. I don't know. I'm saying guys. I'm assuming everybody here is heterosexual. Maybe not. I don't know. But whether you're dating men or women, you want to know the kind of person that you're with. Something about their character, right? And you know what? Even if they say, that's more like with the sickle cell, that's more than I want to take on. Okay, that's okay. They're being honest. You let them go, right? That's fine. But it's better to know, who it is that you're with. And it'll tell you a lot, and maybe head off a lot of heartache. So is dating fun? Have I made it sound fun yet? It should be fun. You should know what it is that you enjoy doing and find people that like to do those things with you. And that's what makes dating fun. And that's what, ultimately, in a long-term relationship, if you're doing things that are fun, you have a wonderful memory bank to draw from. So when things are tough, and they will get tough at some point, you'll be able to think about the happy times that you had and look forward to having those again. Dating is a very important developmental part of a relationship. Use it that way. It can be fun. Make up your mind. You're going to enjoy it. So, happy dating. Possible. Also, what I've heard is that sometimes people get out of relationships that where the sex had evaporated, and they're worried. Okay, or they want to know. But
it's really hard the first time you're meeting somebody.
Well, that's not a person you want to.
Is sex, and so I'm done. So
that's okay. You can be done. Just be done. Well, and then that's your boundary, and that's disappointing. And you're right, that is part of the landscape today, but I know from talking to so many people in my practice that there are lots and lots of people who don't want to have sex with somebody the first minute that they meet, who do want to take it slowly, who want to have an emotional connection before they become sexual. Or they have things going on, those hard conversation kind of things, where they're unable to just jump into bed with somebody. And I think it's okay when somebody, does that, and it's just say, whoa, whoa, whoa. I'm the kind of person that needs to have an emotional connection with somebody. And if that's not important to you, then this isn't a good fit. Bye. Yeah. I need my reading glasses. Okay. Use the term reflective instead of reactive. What are some helpful tips to be more reflective in that time? Well, I think to do things like the exercise that I recommended, your 3 columns: what I must have, what I can tolerate, what I can't stand, and really think about what qualities you want in someone that you're dating. But I would also say, think about the qualities that you want to offer. That's how you meet somebody cool. What do you have to offer? Like if you like movies, be passionate about movies. If you like hiking, be passionate about hiking. People will pick up on that, and if they like it too, that can create some chemistry. And then also, every time you go out on a date, take a little time, sit down and have a cup of coffee by yourself or with a friend and say, how did that go? And if it was a good experience, what made it a good experience? And if it wasn't a good experience, what did I learn from it that I can take into the next experience? That's what I mean by being reflective.
So I have a question here. Can being on birth control long term have negative side effects? So birth control, and I presume for hormonal contraception, it is a systemic medicine, meaning it goes into your bloodstream, and there are definitely some risks, primarily the risk of blood clots. So in your legs, that can travel to your lungs and cause more serious effects. For people at normal risk, non-smokers who don't have a predisposition to forming clot genetic mutations, that risk is very minimal, so it's a very safe medicine. For people who do not have hormonal related tumors in the liver or breast tumors or breast cancer, I would say you can be on birth control, hormonal birth control, long term, so until you no longer need contraception without long-term effects. We often think about negative side effects. There are actually a lot of benefits to being on hormonal contraception. It actually reduces the risk of uterine lining cancer, reduces ovarian cancer risk, and definitely reduces anemia because it really minimizes menses. The second question on this card is, what happens if your body doesn't clear HPV and you're in a relationship? Will you be giving it back and forth to each other? So that's a really good question. The general thinking is that once you have cleared that specific HPV type, you are immune to that. So with viral infections, they treat it this way. But there are, as I mentioned, 30 plus subtypes, so definitely you can get reinfected with a different subtype. Many people may have several subtypes that they carry. So you do not pass back and forth the same HPV between partners once they've cleared it, and especially in men, we don't have a test to know how many, which type of strains they carry. So it can certainly look like you get it, you clear it, it's the same partner, you have the infection again. So unless it's been typed, it's much more likely that it was a different subtype that you're infected.
That's food for thought. Okay, that's a good question. Okay, this is kind of a tough situation. Somebody wrote, thoughts on trauma-informed relationship, how to start a dialogue about triggers. So, sadly, something like 1 in 4 women have experienced some form of sexual molestation or abuse. Not every woman will experience sexual effects, but some percentage do. If you know that about yourself, I would really take my time getting emotionally connected to somebody first, and then I would have that hard conversation. There's something that you need to know about me. I experienced some abuse as a child, And sometimes when I'm having sex, things might happen that, for whatever reason, they're still upsetting for me. If it's okay with you, can I tell you what those are? And then I can tell you what things I really enjoy too. Right. So there are things that I really enjoy, those are yummy, and then there are things that I don't enjoy, and those are yucky. And if the person can't handle it, move on. Because there are people that I would call partners in healing. And whether it's healing from growing up in a house with no love or affection or neglect, or growing up with abuse, or growing up with a parent who's mentally ill, whatever that is, if you meet somebody who is what I would call a rock, someone dependable, someone reliable, someone stable, that person becomes your partner in healing. You still have to do your inner work. You can't just depend on that person. But they can be there, put a hand on your back, and help you. And that's the kind of if you've had trauma, that's the kind of person you really must look for. And it might take time, but they're out there. Okay.
All right, so this question is, can medications affect sexual performance, like antidepressants and anxiety medications? And the answer is yes. Probably the two most common medications that are known to decrease drive or libido are the SSRIs, a very popular type of antidepressant, and actually birth control pills. It does not do so for most people, and there are other kinds of antidepressants, lower dose or non-hormonal contraception. So if that's identified as being really the thing that's decreasing libido or satisfaction, then there are other alternatives, but yes, those two common medications can decrease sexual satisfaction.
Somebody asked some ideas on talking to potential partners about previous, recent, current, other partners, and should I ask if they should be tested for STDs? Yeah. Maybe you need to be tested for STDs so that you can say, I have a clean bill of health. How about you? I think that's how I would approach it. Go get yourself tested and say, I've had testing done, and and that's something I ask all my partners to do before I get physical with them. Lots of people do that. Not that it's not odd. It may be uncomfortable, but I kind of would assume most of the people that you're going to meet have been sexually active. And even if they haven't had multiple partners, you don't know if the partners that they have been with multiple partners. Wah, wah. So, yes. So the answer is yes. I would ask for testing. And then there's another one. Getting into a new relationship after infidelity or divorce. Go slow. Go slow and get to know yourself. Who are you when you're not in a relationship? What I see happen so often is that when somebody goes through a divorce, they are in a lot of emotional pain. And so they want to get rid of it. I don't blame them, but what do? They glom onto somebody right away. I've been divorced I have people in my office. I've been divorced now for 8 weeks, and I met somebody 6 weeks ago, and I don't know, I'm having problems. I'm having problems with sex. I'm like, really? You went kind of fast. Why are you going so fast? How could you be ready when you're in a fragile emotional state? So I would say get yourself healthy first. Spend a few months. It used to be back in the old days, people were told, wait a year after you get a divorce. Nobody waits a year anymore. But how about waiting 6 months? I think that would be reasonable. And I would also highly recommend that you see a therapist to talk about the ending of your marriage. There's a lot of emotional stuff there. There's a lot of grief. People come into my office, we don't do grief well in our culture. And now you've got the ending of a marriage, and there's grief. And guess what? That brings up grief. Every other thing that you never grieved is also going to come up. And if you don't deal with it, you're going to be in a fog while you're dating. And you don't want to be in a fog. You want to have a clear head. So that's my recommendation. Kind of old school maybe, but that's my idea.
I have a question about testing. If there are no symptoms, how do you know if you have HPV or HSV? So HSV can be diagnosed very accurately through blood work. So even if people have not had symptoms, you can check for the antibodies to herpes type 2. So that would be part of that clean bill of health you could show. The caveat for the blood test is that if it is a recent infection, so within the last month, and your body may not have actually made antibodies yet to herpes, and actually that can be the scenario when you actually have an outbreak, a first outbreak, the blood test may be negative. But past that month's time, the blood test is very accurate. And that's for men and women. For HPV, women are screened in the US through their cervical testing. So kind of routinely after age 30, HPV is checked for. It's not routinely checked for under age 30 because it is so common, as I mentioned, and it comes and goes. And we really don't change the screening strategy based on a positive HPV in younger than age 30, as long as the actual cells of the pap are normal. So women get screened for high-risk HPV via their pap smear or specifically through HPV testing. There is not widely available testing for men. Certainly they carry HPV, that's how it gets transmitted between men and women, but there is not a reliable test that could show that the HPV is truly negative. If you did a swab of the male genitalia and it came back positive for HPV, just as you would swab for women, that would indicate HPV. But a negative swab does not necessarily indicate there is no infection. It's not the cervix is much more contained. It's very sort of easy to sample. Male genital not so much so. And so that's not something that is screened for in men. And also they don't have themselves that health consequence. They don't have cervical precancer, cancer, a similar situation to be screened for. So that's the testing. Seems a little unfair, but at least as it is currently, there is not routine testing for men.
I think this might be my last question, which is, can counseling prevent divorce? That's a really great question. The answer is maybe. It can. It definitely can. I've helped lots of couples that have come into my office and they were at the edge of the abyss, and they work on their relationship. Each partner works on themselves, and I help with communication or whatever it is that is getting in the way of having a happy relationship. The problem is most people wait too long before they come to see the therapist. Most people, there's one piece of research that says on average people wait 7 years to go in to talk to a therapist. Like one of them says, maybe we should get counseling, or they think we should get counseling, and 7 years later one of them is picking up the phone. And by that time the damage that's been done is much more difficult to undo. It also means that there's some desperation there. So if you are thinking that your relationship could use a tune-up or you need some help in a certain area, don't hesitate. Go talk to somebody. It will be much cheaper and take a lot less time if you call after you've been having problems for a year than if you wait until 7 years. Makes sense? And then the therapist is more likely to really be able to help you.
So I'll make this my last question as well then. Can you talk about estrogen replacement for painful sex? So assuming that the reason for painful intercourse is due to vaginal atrophy, the thinning of the vaginal skin that accompanies low estrogen states, primarily menopause, but also during breastfeeding, then vaginal estrogen is very effective. There are several different formulations. There's a cream, there's a tablet, there's a suppository, there's a ring. All of these deliver estrogen directly to the vaginal skin at low doses. Generally, those are dosed twice a week. And it does not increase estrogen in your bloodstream in any appreciable amounts. So even in women, let's say, who've had a breast cancer history, as long as they've been at least several 5-ish years from their diagnosis, it's generally considered a safe therapy. So local therapy, vaginally this way, is not the same as getting hormone replacement. Certainly hormone replacement can help this too, because it goes through your body and then to the vaginal skin, but you can more directly and kind of selectively affect vaginal skin through these vaginal formulations, cream, tablet, suppository ring.